Good morning, everyone. The program will begin momentarily, examining food insecurity in Rhode Island. Good morning, everyone, and welcome to the first of what will be several events building on our discussion from the 2021 Rhode Island Food System Summit back in January. My name is Catherine Flynn. I'm the Executive Director of the University of Rhode Island Business Engagement Center, and we hope that these follow-on events will help to continue the conversation and help us as a community move toward greater food security for all Rhode Islanders. For this event, we have partnered with the Rhode Island Public Health Institute and Grow Smart Rhode Island, who have organized this event for you today. Today's panelists will further discuss the causes of high levels of food insecurity in Rhode Island and the potential methods to alleviate this public health problem. It should be noted that the panel discussions that take place today do not necessarily reflect the position held by University of Rhode Island. We are learning about these opportunities at the same time as you are, and this event should be very, very interesting for those of you who are interested in this subject. To kick off the event for the day, I would like to introduce Other Kane, who will be your MC for the first panel. A TV news anchor, radio, talk show host, and blogger, Other has been a collaborative partner with Dr. Amy Nunn and her work for the Rhode Island Public Health Institute for several years. Welcome, Other.
Catherine, thank you. Good morning, everyone. I'm Other Kane from Jackson, Mississippi. I'm excited to share in these panel discussions today. This promises to be a very informative event. It's my pleasure now to introduce to you Dr. Amy Nunn. Dr. Amy Nunn is the Executive Director of the Rhode Island Public Health Institute and Professor of Public Health and Medicine at Brown University. As Executive Director, Dr. Nunn leads evidence-based research and programs that improve health outcomes in Rhode Island and beyond. Dr. Nunn has over 15 years experience at directing community-based research and programs to improve public health. She is best known for her innovative programs to address racial disparities in HIV infection, creative efforts to promote access to healthy foods, and commitments to advocacy-related health equity. In 2020, under her leadership, the Rhode Island Public Health Institute launched Open Door Health, Rhode Island's first LGBTQ clinic. Dr. Nunn holds master's and doctoral degrees from the Harvard School of Public Health. She's very fluent in Spanish and Portuguese. She is a wife and mother of two. Dr. Amy Nunn.
Good morning. Thank you, everyone. I'd like to start by thanking the University of Rhode Island for hosting us and being so gracious to help us raise awareness about food insecurity and healthy eating across the state and the country. I'd also like to thank the Center for Science and Public Interest and also the American Heart Association for their current and ongoing support of this important initiative related to the sugary beverage tax and SNAP incentives in Rhode Island. So why we're here today, Rhode Island now has hunger and food insecurity rates that are at an all-time high. The crisis has mushroomed as a result of the COVID-19 pandemic. All of us know how difficult this time has been for many people and how many people have lost their jobs as a result. That has downstream impacts on food insecurity and also on healthy eating. Today, we're going to talk about some potential solutions to this challenge. We're going to talk about a proposed sugary beverage tax for the state of Rhode Island. Rhode Island has the opportunity to be one of the first states to implement a sugary beverage tax across the state. Several cities have done that around the country, and now is the time to do this. There are also big public health opportunities associated with this. We believe that we could use proceeds from a sugary beverage tax to support healthy eating across the state. We are proposing, in partnership with legislators from across the state of Rhode Island, a legislation that would introduce a 50% discount for people shopping with SNAP who are buying fruits and vegetables in retail settings. So today, these are the things we're going to be talking about. You'll be hearing from our sponsors, Senator Lawson and Representative Barros on the House side, who will be telling us all about this. You'll also be hearing from experts from around the country and people who have experience implementing and overseeing sugary beverage taxes in the city of Philadelphia. Today, we're also pleased to announce that we'll be launching a communications and advocacy campaign around this important initiative that's called Nourish Rhode Island. And we hope that you can learn along with us today. You can follow this as this issue moves along at www.riphi.org. And if you're interested in joining our advocacy campaign, please take a moment at the end of today's event to sign up for our survey, to sign up for our campaign by filling out the survey and sharing your information with us. So again, I just want to thank everyone, and in particular, our legislators who have so graciously lent their voice to this important issue. And with that, I will pass the baton back to Other Kane.
Dr. Nunn, thank you very much. I'm excited now to introduce a very impressive panel who will lead the first part of the discussions. Joining us this morning is Dr. Jim Kyrillos. He is the Executive Director of Healthy Food America, whose mission is to promote healthy food policy through policy analysis, technical support, research, and public education. He is Clinical Professor of Medicine and Public Health at the University of Washington, where he has worked on several SSB tax evaluation projects. He has served on the Institute of Medicine Committee on evaluating progress in obesity prevention, and currently serves on 6 national advisory committees for initiatives that promote and evaluate healthy food policies. Dr. Kyrillos has played leading roles in design, adoption, implementation, and evaluation of SSB taxes in multiple United States cities, and is currently working on pending tax legislation in his home state of Washington. He has been a key leader in the development, adoption, and implementation of Seattle's SSB tax, and served as co-chair of the city's Sweetened Beverage Tax Community Advisory Board. He also has substantial experience with healthy food incentives, having been a leader in the model approach for integration of SSB taxes and healthy food incentives in Seattle. Dr. Stephen Boardmaker is a professor of practice of health psychology at the Harvard Chan School of Public Health, where he directs the Harvard Prevention Research Center on Nutrition and Physical Activity. His recent work includes the Choices Project, focused on understanding and modeling the cost effectiveness of interventions that can improve children's nutrition and physical activity and reduce the prevalence of obesity. Dr. Boardmaker's research with colleagues has documented the energy gap responsible for recent increases in obesity among children and youth in the United States, and the important role played by excess intake of sugar-sweetened beverages. He has been an author or co-author of more than 240 published research articles, including the first report in the United States concerning the obesity epidemic among children and youth. Council member Derek Green. Derek Green has served as an at-large member of the Philadelphia City Council in Pennsylvania since 2016. He holds a bachelor's degree from the University of Virginia and a JD from Temple University School of Law. His professional experience includes serving as special counsel to City Councilwoman Marion B. Tasco, counsel Finance and Public Health and Human Services Council committees, and manager and counsel on several campaigns. He has also been a Philadelphia Deputy City Solicitor, Assistant District Attorney, and Assistant Deputy Attorney General for the state of Delaware. As a member of the City Council, Councilmember Green voted in favor of the solar tax in Philadelphia, which passed in 2016. And the bill's sponsor, Senator Valerie Lawson. Valerie J. Lawson is a member of the Rhode Island State Senate representing District 14. She is a lifelong resident of East Providence and holds both a bachelor's degree and master's degree from Rhode Island College. Senator Lawson is a social studies teacher at East Providence High School and is vice president of the National Education Association of Rhode Island. She also serves on the executive boards of the Rhode Island Labor History Society and the Rhode Island AFL-CIO, and is a member of the Providence Central Labor Council. In addition, Senator Lawson is the former president of the East Providence Education Association. She was first elected to the Rhode Island Senate in November of 2018. Representative Gene Barros. Gene Barros was first elected to House District 59 in Pawtucket in November of 2014. He was first named a deputy majority leader at the start of the 2017 session. He sits on the House Finance Committee and is the chairman of its Public Safety Subcommittee. He is also a member of the House Municipal Government and Housing Committee. Prior to his election to the General Assembly, he served for 6 years on the Pawtucket City Council. He previously served on the Juvenile Hearing Board from 2007 until 2010, and then on the Charter Review Commission. A graduate of Pawtucket's Tolman High School, he received his associate's degree from the Community College of Rhode Island and his bachelor's degree in science from Springfield College. He is the Director of Public Works and Code Enforcement for the City of Central Falls. Please welcome our very distinguished panel this morning. And we've got tons of questions. And you can tell that these folk are heavyweights. So we'll get right to our questions this morning. Again, thank you for being here. Dr. Krieger, we will begin with you. You've spent your career advocating for the implementation of sugary drink taxes to fund food access and community programs. Can you tell us this morning about the success you have seen in Seattle with the passing of this tax, including how much revenue was raised and the programs that revenue is currently funding?
Sure. Thank you, Otha, for that question. We here in Seattle implemented our tax back in January of 2018, so a little bit more than 3 years ago. So we have 3 years worth of experience now. Our tax is 1.75 cents per ounce on sugary drinks, the same sugary drinks that are included in the Rhode Island bill, like soda and fruit drinks, sports and energy drinks, and so on. And similar to Rhode Island, we also have an exemption for small manufacturers. The tax is working as promised and as expected, which is exciting for us. We're raising about $22 to $24 million a year, and a rigorous evaluation conducted by Lisa Powell and her colleagues found that when we compared the sales of sugary drinks in Seattle, which is in the bottom dark blue line, you can see immediately after the tax went into effect, sales dropped by 22% compared to no change in the comparison community of Portland. So a significant decrease in sales right after the tax took place. The next slide, please. The other interesting thing, sorry, one slide up. There we go, is that there was no really cross-border shopping. I mean, people did not leave Seattle to buy sugary drinks elsewhere. That bottom line there, for example, I'm sorry, next slide. You're not showing the slide, sorry. There we go. Shows that the tax is basically in a 2-mile radius around Seattle. Sales didn't change at all in Seattle or Portland. So people weren't leaving Seattle to buy more drinks elsewhere. Next slide, please. Our revenues are being spent primarily in 2 areas. The biggest area is healthy food access and health promotion, primarily in healthy food, also in early learning and child development. So particularly what we're spending our money on is nutrition vouchers, very similar again to Rhode Island. Next slide, please. The next slide, which provides healthy food subsidies for low-income people in Seattle. Slide up. There we go. Which helps increase fruit and vegetable affordability, purchases and consumption, and also supports our local food system. We spent $4.3 million on these in 2019. Notably, last year, an additional $5 million went to grocery vouchers during COVID to help 6,250 families buy groceries, $800 for each family. So the funds are being used exactly as proposed, and I think we are seeing a great success here.
That's good news. Thank you very much. We'll move now to Dr. Goremaker. You lead a very exciting project called the Choices Project at the Harvard Chan School of Public Health. Can you tell us about this project and the health implications for children that can result from sugary drink consumption?
Sure. Thank you. One of the things we've studied is just where obesity is heading in the United States. And our Choices Project has shown that more and more people are developing obesity and that these numbers will continue to increase. For example, this is true for Rhode Island too. We've made projections for Rhode Island. Right now, about 40% of adults in Rhode Island have obesity, and we project that by 2030, 47% will have obesity and 23% will have severe obesity. This is unless we change things to make a difference. At the same time, obesity rates among children are quite high. Racial and ethnic and income disparities persist. Also, we've done research for many years documenting the health impacts of sugary beverages. For children, it increases excess weight gain, and for the entire population, it increases your risk of future diabetes, cardiovascular disease, cancer. It's a slow increase that's there, but it's slow and it just keeps on happening. And if we look at all the different behaviors, the dietary behaviors that contribute to obesity among both children and adults, there's really nothing so clear-cut as sugar-sweetened beverages and their contribution to excess weight gain and chronic disease.
I think those trends are prevalent across the country. Turning now to Council Member Jared Green. Councilman Green, you voted in favor of the sugary drink tax in Philadelphia. Can you tell us this morning why you chose to vote to pass this tax and the effect you've seen it have on your community?
Well, thank you for that question. Thank you for the opportunity on this panel to talk about this issue. I think fundamentally, for any type of tax or revenue enhancement, it's got to be something that's done that the voters believe in, and there's a clear message. For me, as someone that comes from a background of being a small business owner, there were some issues raised about the impact that this tax would have on small businesses. Ultimately, it was the investment that we're making in our children and into our city. The source of funds of the 1.5 cent soda tax or sugar sweetened beverage tax was going to be used and was used for a pre-K initiative in the city of Philadelphia that was going to benefit the children of the city of Philadelphia. Also, to make an investment under a program called Rebuild, which will make a significant investment in our parks, recreation centers, and libraries. And so whenever you have that type of tax or revenue enhancement, you have to make sure that there's going to be a benefit that voters can really believe in. I think it's also important to reflect on the history of the soda tax in the city of Philadelphia. Under the previous mayor, Mayor Michael Nutter, who had a close relationship and still does have a close relationship with Mayor Michael Bloomberg, and saw what happened in New York, wanted to do a similar type of tax in the city of Philadelphia. He proposed a 2 cent per ounce tax. Initially, that was money that was proposed under the first initiative to fund education and fund the schools. The American Beverage Association, others came out very strongly against that. I think part of the challenge is that people had some concerns regarding how the school district historically has managed money, and that legislation was not initially passed. Mayor Nutter tried again to pass a soda tax or a sugar sweetened beverage tax, and tried again at 2 cents per ounce. Initially, it was proposed as a healthcare initiative, but then the messaging shifted to more of a revenue, and we needed revenue for the city of Philadelphia. And so that failed again. Interesting enough, our current mayor, Jim Kenney, was an at-large member of city council and voted against the soda tax. As you fast forward to 2015, Jim Kenney decided to run for mayor. One of the campaign pledges that he made was to provide universal pre-K for the city of Philadelphia and for students in the city of Philadelphia. And then once he came into office, he decided to use the soda tax initiative as a way to fund the universal pre-K, as well as this new initiative called Rebuild. And initially it was proposed at a 3 cent per ounce proposal, which is, a cent higher than what Mayor Nutter tried, that twice failed. However, I think because of consistent messaging from the mayor during the campaign of working on pre-K, and that we as a city need to make an investment in our children, as well as the other additional program called Rebuild, to really make significant investments in our recreation centers and our parks, many that have not seen significant major investments in decades. I think that's what was able to get this bill passed. And also there was a compromise to bring the actual package down to 1.5 cents per ounce. And so I think based on how this proposal was presented under the consistent messaging from the mayor during his campaign and during his first year in office, I think that's why it was supported by members of council. And someone like myself who has a child who's on the autism spectrum and this child who's in the school district really thought we needed to make this type of investment in our children. And I think that is one of the reasons why people supported this legislation. There were a number of advocacy groups that came together, many that did support the mayor during his campaign for mayor, and then supported his campaign for the sugar sweetened beverage tax. And I have seen an investment in our neighborhoods and communities around the city of Philadelphia, where we've been able to remake a number of parks and recreation centers in our city. We also were able to launch the pre-K program, where a number of small business owners were able to receive, funding to enhance and expand their pre-K initiatives. And we've also been able to start another initiative called Community Schools, where we've been able to take schools in the city of Philadelphia and extend their hours to provide other services. So in closing, I think this is a program that I've seen benefits in our city. There were challenges. We had a number of lawsuits at both the local level and then the Commonwealth Court, which is a statewide court, and ultimately up to our Supreme Court, that the city was successful. It did cause some delays in implementing the program, but fundamentally the message of making an investment in our children is something that I think the voters supported, as well as members of council.
I think we can all agree that consistent, effective messaging is critical to this discussion. Dr. Jim, you wanted to make a comment about a point made earlier. We'll pull you in now for that.
Oh, no, I think at this point, I just wanted to thank Steve for pointing out all the health effects of sugary drinks. And one of the things that's caught my mind is the rapid rise of diabetes, type 2 diabetes in children that we've been seeing in communities across the country. And that shows, I think, is one of the diseases linked to sugary drink consumption. And particularly of concern, all these health indicators that Steve mentioned, and this one as well, is the disproportionate burden that these diseases play on people of color and low-income communities. For example, in the diabetes rate among youth, the rate among Black youth is 7 times higher of type 2 diabetes than it is among whites. And so I think there's an important health equity issue here that taxes can help address by both going to the root cause and investing, as Councilmember Green said, in those communities most affected by sugary drinks to try to right these wrongs of health inequities.
Thank you for highlighting that. Very, very important. Turning now to questions for both Representative Barros and Senator Lawson. Representative Barros and Senator Lawson, you have each introduced this bill in both the House and the Senate. Can you each tell us why you chose to sponsor this legislation and why you feel that this is an important public health policy for Rhode Island? Let's start with you, Senator Lawson.
Sure. Good morning, everyone. It's a pleasure to be here today. I'm sponsoring the legislation because I think it creates great public policy. And I think it does so in 2 different ways. It provides, everyone has mentioned, the retail SNAP incentive that will provide the 50% match for low-income families to purchase fruits and vegetables in a retail setting, so it expands the opportunity, and it's available year-round. And at the same time, it will allow Rhode Islanders to make healthier choices, which the facts presented to us already show is necessary. And with healthier choices, hopefully we would have healthier outcomes. So for those 2 reasons, I think it's a great piece of legislation.
Representative Barros.
Yeah, thank you, Catherine and URI for actually putting on the summit. I chose really to sponsor this legislation again, and I co-sponsored again with some of my colleagues in previous years for the many reasons that Jim and Steve have mentioned in terms of the health effect that it has on primarily on the community of people of color and folks in the low and moderate income tax bracket. And not only that, like we said, I mean, my thing is if we are able to do something in the area of behavior change for the folks in my community and folks in the low and moderate income bracket to help drive down the cost of some of the health costs. And we've seen that it does work in other communities. And even before that, we didn't have all the information that we have today, and that we're actually hearing today about other communities and how it has impacted the community and how they're using those funds to actually bridge the gap in the disparity amongst communities of color. And that's one of the primary reasons why I chose to sponsor this legislation again.
Well, thank you both for your leadership. It's very, very, very important. Dr. Jim, I want to go back to you. These taxes have previously been labeled as a regressive tax. Can you explain why these taxes are actually beneficial for low-income communities when the generated tax revenue is reinvested in beneficial programs such as the Retail SNAP Incentive Program as proposed there in Rhode Island?
Yeah, thank you for that question, Arthur. I think that a well-designed sugary drink tax, like the one in Rhode Island and some of the other ones we're seeing across the country, promotes health and social equity because it benefits the people who are most affected and harmed by the beverage industry's sugary drink products and their predatory marketing. So if the revenues, as you mentioned, Arthur, if they're invested to benefit these folks, then that will blunt the effects of sugary drinks on those communities. If the revenues are invested in ways that respect community priorities and values, then they will promote the interests of those communities and therefore promote equity. If they're invested to address the social and economic determinants of health, as we've seen, for example, in Philadelphia with early education, then they will promote the health of those communities. And if there's authentic community engagement and leadership by the impacted communities throughout the policy process, shaping the legislation, and then monitoring and having some degree of oversight and accountability as the revenues come in and as they're allocated, that increases community capacity and it increases community agency and lifts up and builds the strength of communities. So I think when taxes are designed this way, they are actually increase equity and they're a progressive public policy. Particularly, we've seen how revenue investment already, we've heard many examples of that. And I think given Seattle's, for example, investments in healthy food incentives and the proposed investment in the same type of activity in Rhode Island, it's worth remembering that there's scientific evidence that shows that when people are given fruit and vegetable incentives, and then in the SNAP population, the people who get food benefits, that these increase consumption of fruits and vegetables, and that in turn will make people healthier. So this is an evidence-based approach to improving health of communities. Turning to the broader picture away from Seattle specifically, I just wanted to mention that my colleague Chris Mattson from the University of California in Berkeley and I have looked at how the revenues are being invested across all 7 cities and counties in the United States that have taxes right now. And what we found is that these places, when you aggregate it, the 83%, so the vast majority of revenues are being invested in communities of color and in communities that low-income people live in. And they're addressing a wide range of social determinants of health, like early education and childhood, chronic disease prevention, helping kids graduate high school and go to college, as well as healthy food incentives. So they're supporting grassroots organizations in these communities that are delivering the programming to make these benefits available to their community members and therefore increase access to healthy foods and other important policies. Now, one thing that's really important is that when the revenues are invested, that there are mechanisms so the community can have a strong voice and role in how they are invested. And there are lots of different ways to do that. Many of the cities that have these taxes, for example, right now, have community advisory commissions or boards that make recommendations to city council. And oftentimes, actually in almost all cases, the city council has opted to honor the recommendations of these community advisory commissions or boards. Or when specific programs get put in place, like in Philadelphia, there are also community advisory processes to decide how best to use those revenues to improve community facilities like libraries and parks and rec facilities. So as long as when there are mechanisms in place like this and when the public's made aware through reporting and monitoring, the funds will be used accountably to benefit the communities most affected by sugary drinks. So I think the other way that these positively affect communities, we heard, is that they will improve the health of these communities through both reductions in consumption and the health effects produced by the revenue investments. And particularly, they will benefit disproportionately and progressively low-income communities where consumption is higher at baseline before the tax goes into effect. So the tax actually will have a bigger impact on low-income communities and communities of color. And we've seen this in other evaluations, for example, in Mexico, where they've been a tax since 2015, where consumption dropped much more in low-income communities in Mexico than high-income communities. So overall, taxes will have beneficial effects because of the way revenues are allocated and their effects on consumption. And it will be a net positive and progressive policy.
All right, very good. So I know you guys are filled with so much great information, but we're going to ask that you keep your answers a little more succinct so that we can get to all of our questions and the rest of the panel. Dr. Steve, to you now. You have published extensively on the cost effectiveness of a sugary drink tax in the United States. Can you share with us your research conclusions, including the long-term health impacts that demonstrate that this tax could substantially reduce BMI and healthcare expenditures and increase health life expectancy?
Sure. In our choices work, we've worked to identify policies and programs that can reduce child and adult obesity, improve health equity, and deliver the best results for the dollars invested. And we've looked at a lot of interventions, and sugar-sweetened beverage excise taxes are one of the most effective interventions out there, cost-effective interventions with the potential to improve health equity, as Jim mentioned. We've estimated models and projected the impact of models in cooperation with health departments in multiple states, New Hampshire, West Virginia, Washington, Alaska, 4 others currently in process, along with estimates from more than 20 cities and counties. And in all cases, the tax is projected to result in substantial obesity reduction in children and adults, and as Jim mentioned, also a reduction in disparities, so improvements in health equity. And in all cases, it's projected to be cost saving, to save more in future healthcare costs than the tax actually costs to implement. For example, in New Hampshire, it's projected to save $15 for every dollar spent. At the same time, we've calculated actual numbers. If we were to just scale the results for the United States that we've projected, for the state of Rhode Island, we project more than 10,000 cases of obesity prevented in a year, more than $50 million in healthcare cost savings over 10 years. And at the same time, we would also project that you'd see reductions in health disparities over time. So a sugar-sweetened beverage excise tax in Rhode Island, which just seems like a good deal. You know, tobacco taxes have been effective at saving lives. Sugar-sweetened beverages, I think, work more slowly to kill you. But implementing an SSB excise tax is really an opportunity to cost-effectively stop unnecessary deaths and improve health equity.
Thank you very much for that. That's some clarity that I think we all need. Councilman Green, to you now. One of the arguments against the implementation of this tax is the potential job loss that could result from it. However, a recent study out of Philadelphia showed no evidence of a negative employment impact 2.5 years post the tax passage. Can you elaborate on this?
Yeah, when the legislation was proposed, a number of people raised that concern, especially constituencies from the beverage industry, small grocers and supermarkets, as well as labor, who were concerned that their members would lose jobs. But even before the soda tax was passed, I know I had an opportunity to visit one of our local bottlers, and they were already seeing large shifts in the industry and people consuming less soda. And, they were actually selling more of their non-soda products. So I agree with a lot of the other panelists in reference to this type of legislation shifted behavior. But also what you found is that for those small grocery stores, they were able to change and switch in reference to other type of products that they were consuming from the same bottlers and also from the same labor organizations that were now transporting those beverages to those grocers. But one of the other things that was not talked about is the increase in jobs, how we were able to increase the number of small business owners who provided daycare, and also some of the contractors were able to get work based on the Rebuild initiative by investing in our parks, recreation centers, and libraries. One of the things that I see that's so important about what's being proposed in Rhode Island, because that benefit is going to go back into those stores, and that's going to help to offset whatever reduction, if there is a reduction, in soda being delivered, but there'll be people buying goods and services in those stores, which will be a benefit for those stores. And I think that continual shift and loss of consumption will continue. And so the red herring about job loss is really not as prominent as was initially stated.
All right, thank you, Councilmember Green. Dr. Jim, I think you want to add to that?
Yeah, I just want to say in Philadelphia, it's been extensively studied by scientific research about the effects on employment, and employment's actually increasing after the tax went into effect in restaurants in Philadelphia. And unemployment claims, another measure of job loss, hasn't happened. The unemployment claims in potentially affected industries like grocery stores and supermarkets, food service, soft drink manufacturers, there's been no increase in unemployment claims. So it is a red herring, as Councilmember Green mentioned. And Berkeley had the same experience. After the tax, employment in the food sector increased by more than 7%, and nearly 500 jobs were added in that sector, such as in restaurants or supermarkets. So the tax actually can increase jobs, both through the investment of revenue and also just because the sales are compensated for by other products. So it's a red herring and misinformation that's put out by the beverage industry.
I'm reminded of a comment someone made earlier. Consistent, clear messaging is very important. I want to pull Dr. Amy Nunn into the conversation now. Dr. Nunn, your organization runs a direct service mobile produce market program called Food on the Move, where you currently offer the SNAP incentive discount. Can you share with us this morning your research and the demonstrated effects that the SNAP incentives have had for your customers?
Absolutely. That program is supported by a lot of different donors, including the U.S. Department of Agriculture, Blue Cross Blue Shield of Rhode Island, AARP Foundation, and others. We've also benefited from support from the Health Equity Zones Initiative across the state of Rhode Island. We serve about 5,000 low-income Rhode Islanders, overwhelmingly at subsidized housing sites across the state, and we also serve a lot of older adults. And what we have found is that when we offer SNAP incentives, people immediately change their eating behaviors. We have documented and published in scientific articles that about 80% of our customers consume more fruits and vegetables as a result of shopping at Food on the Move and because of the SNAP incentives. This basically means that we are subsidizing healthy eating behaviors. So we are creating financial incentives for people to improve their fruit and vegetable purchase and consumption. And it works, basically. So what we're really hoping to do, and so we built the scientific evidence base for that program, along with people from around the country who are also working on SNAP incentive programs. Basically, we know that if we do this, we will enhance people's healthy eating behaviors, because when people have more purchasing power, they buy more healthy food. And we have built that scientific evidence base, and it is ironclad. We're hoping now that what we can do is expand access across the state by taking what we've learned from Food on the Move and expanding it into grocery and retail settings. Currently, Farm Fresh and Food on the Move are the only two programs in Rhode Island that offer SNAP incentives, and they have also seen similar results. So we know that this works. The key now is getting this into places where we know people prefer to shop, which is at grocery stores. So we have a mobile program, but what we need to do now is use this opportunity to expand it into retail settings.
Very good. Thank you, Dr. Nunn. We need to get this Food on the Move program in Mississippi. Senator Lawson, to you now. Opposition of the SSB tax has previously stated that tax implementation could lead to cross-border shopping. Can you explain why using this tax as a funding mechanism for the retail SNAP incentive program would actually negate that argument?
Yes. So one of our priorities when we were designing the bill was to look at the economic standpoint to ensure that we keep business in Rhode Island And in previous iterations of the bill, there had been a concern that Rhode Island residents would cross borders to Connecticut and Massachusetts to do grocery shopping. But as just previously mentioned, by pairing the revenue as a funding mechanism to the retail SNAP incentive program, there's an incentive for low-income families who would be the ones that would feel the effects of the tax to buy their groceries in the state of Rhode Island, because they'd be receiving the 50% match on their fresh fruit and vegetable purchases. So we believe that incentive addresses that.
Very good. I know you wanted to mention DHS as a partnership.
Yes, I just want to acknowledge that the Department of Human Services in Rhode Island and Courtney Hawkins and Maria Semini in particular have been amazing supporters of this effort. And they also believe that this is something that could be possible in Rhode Island if we were to have funding support to do it. What we need now is a mechanism to fund what we know culminates in big behavior change, both through reduced consumption of soda, but also enhancing people's access and consumption of fruit and vegetables.
All right, thank you very much. In just a moment, we'll pull in questions from our audience members. And so if you have questions, feel free to share your questions with us in the comment section. Representative Barros, to you now. In other state models, the implementation of a retail SNAP incentive program has had significant positive economic implications. Can you elaborate on this and the potential effects we could see in Rhode Island?
Yes, thank you. And contrary to the job loss assumption that Councilman Green discussed, we here in Rhode Island actually anticipate that this could potentially generate new jobs for Rhode Islanders in the areas of grocery retail, produce distribution, and local farming. With the implementation of this program, we anticipate a significant increase in the demand for produce. This has been shown in models in other states. Retailers in Michigan, for example, experienced a 34% increase in produce sales between the years 2015 and 16, following the implementation of their SNAP incentive program. It's also important to note that in this bill that Senator Lawson and I, we wanted to make sure that the small business were protected. There has been an exemption sort of built into this bill that would exempt small bottlers with a certain, worldwide gross income of less than $2 million from the previous year. So I think, in terms of the positive impact that this bill would have, certainly would create a healthy Rhode Islanders. It would certainly exempt some of our small businesses, reduce some of the health costs that our two experts on the line have already mentioned, and there's certainly the potential for job creation. And the effects that I actually like the most is the behavior change, particularly behavior change in the communities of color and folks of low and moderate income.
Thank you, Representative Barros. We're going to turn our attention now and pull some questions in from our audience. We've got a very robust and engaged audience today. And so the first question comes from Amanda Clark. In the communities that this tax has been instituted, has there been documented evidence of improved health outcomes? Jim or Steve, you want to take a step?
Sure, I'm happy to jump in on that one. The one clear outcome is that there have been big drops in sugary beverage sales and also consumption. If you're not selling it, if you're not buying it, you can't consume it. The longer term health effects, like on cardiovascular disease, diabetes, cancer, that's going to take a longer time to show those impacts. Some of those studies are actually underway right now, just been funded by NIH, for example, but that'll take a longer time to look at those longer term health outcomes.
All right, Jim, anything to add there?
Yeah, no, just add that, as documented in study after study, the association of sugary drinks with diabetes, with heart disease, with obesity, with tooth decay, the evidence is rock solid about the association of these beverages with harmful health effects. And so it stands to reason quite clearly that when we reduce sales and consumption of these products, ultimately, as Steve mentioned, and when we have long enough time to examine for these effects, we will find these outcomes are improved and these rates of diabetes, these diseases go down and health disparities are lessened.
All right, very good. Let's go to our next question from our audience. This comes from Morgan Brinkler. Thank you for speaking with us about this topic. While obtaining healthy foods is important, conversations with vulnerable populations mention that storage of these foods is a barrier. Could you speak briefly about how Food on the Move and other programs could address this barrier? Dr. Nunn, we'll let you take a stab at that one.
Thank you. I agree that this can be a challenge. Particularly, we know that a lot of folks get their SNAP benefits at the beginning of the month and then do big buys that they then have to stretch, and they have to stretch their food budgets for a long time. And that's the reality. And this can be a challenge to, for a lot of our populations. What we try to do is to bring our program there frequently. We stack our program a little bit towards the beginning of the month because we know that that's when people need us most and have the most resources to spend. And just to give an example of how we've responded to that challenge, what we try to do is to but before, we had our markets less frequently and we went to more sites. But when we learned that people were eager to spend their SNAP incentives at the beginning of the month, we stacked our markets accordingly. And now we go once a week so that people can also have steady access to fruits and vegetables rather than just once a month. So we try to visit our sites at least once a week.
Very good. Thank you, Dr. Nunn, for that. We'll take our next question. This comes from Kim Gaines. Hello, I am wondering what the timing of this bill is and what is different this time since we have tried to pass it in Rhode Island before. What will increase the likelihood of passing the bill this time?
I think that Representative Barros may be best poised to answer this question because he has sponsored this legislation in the past. I think there's, but I'll weigh in briefly. I think, and I want to acknowledge also Dr. Gann's work. The Food on the Move program began as a randomized controlled trial that she oversaw and built the scientific evidence base for an entire decade. So let me thank her and thank her for attending today. But I think that we now have a lot of political momentum around this. And frankly, the budget crisis that COVID has brought upon the state make this a viable source of revenue for the state, both for the SNAP incentives, but also for the general fund. We believe that there's political opportunity with that. And we also have unprecedented rates of hunger and food insecurity. And so there is more acute need now than there ever has been before. I want to make sure that Representative Barros weighs in about this as well.
Thank you, Dr. Nunn. So I think the biggest problem that we had with the bill the years prior was the fact that it was based on a tier approach. This bill this time sort of tweaks a lot of those point of contention from the previous bill. So that's the main difference.
All right, thank you very much. I certainly hope that clears that question. Let's take another question from the audience.
May I also add one thing, Other? I think there's another difference this time around, and that is that a small business exemption has been added to this to protect small businesses who might experience any kind of hardship. So I believe that our congressional partners have really listened and tried to hear the concerns of small businesses about the legislation.
Very good. I think that's very important that they are in tune with what our small businesses and the community at large is saying. Let's go to our next question now. Sugary beverage taxes are modeled after cigarette taxes. Can you explain the modeling between these taxes and the public health impacts that could take place, like the impacts from the cigarette tax? And whoever wants to take that one can.
Sure, I'm happy to comment. a sugary beverage tax will, of course, reduce sales and consumption of sugary beverages in the same way that the tobacco taxes have reduced sales and consumption of cigarettes. Early on, I would point out that people had questions: would they really work? Would people really stop buying? And the answer is yes, they certainly did. One thing that's very clear, though, and a difference with tobacco taxes, is that consumers are more responsive to sugary beverage tax increases. They pretty quickly move away from consuming sugary beverages. They're not as addicted to these substances as they are to tobacco. And so people move away from them. And that's one of the reasons you really see these impacts that we project, because people are very willing to stop consuming sugar water as the price goes up. Jim, did you want to add anything?
The only thing I'd add to that, Steve, is that we've had enough time to see the effects of this decrease in sales and smoking rates from tobacco taxes. And we see the rates of smoking-associated diseases are going down, like lung cancer as the primary example, and that's directly attributable to these taxes.
All right, very good. You know, time is winding down. We could go hours with this panel discussion, but we'll take our final question from the audience. How do we sustain the ability for families to afford fruits and vegetables once funding decreases or is unavailable? That's a great question.
You know, I can jump in quickly on that. I'm not sure why funding would decrease. What we've seen now, where taxes have been in place for 3-4 years in places like Berkeley and Mexico and other places, is revenues don't decline. There's a one-time drop in the sales of sugary drinks, and then they plateau out. So there's a stable tax base, actually, long-term, that generates revenue that will generate the funds to buy the fruits and vegetables. And then these subsidies can be continued through this tax base.
All right.
And if I could also follow up, you know, as a elected official, and I think both Steve and Jim talked about the health impacts of soda and how it impacts individuals, but it also impacts us as elected officials and the costs that we spend in reference to trying to address our constituents. When people are getting diabetes, a lot of these other type of illnesses directly related to the consumption of sugar. It's the reason why we need to look at a sugar-sweetened beverage tax, like a sin tax, like we do with cigarettes, because it has a significant health impact for our constituents, but also has an economic impact on us at the local and state level, and also federal level, as we're trying to pass legislation and work with our budgets and deal with the impacts that these type of products have on our economy. So it's definitely not only a health benefit, but it's also a way of trying to reduce some of the costs we have that we deal with at the local, state, and federal level as elected officials.
All right, Councilmember Green, thank you very much for that input. Listen, thank you all for being with us and providing us with all of this amazing information. I am a perpetual student. Dr. Nunn, we'll turn to you now for your closing comment.
Thank you. I just want to thank everyone that made this whole event possible, and remind everyone that this is just the beginning. If you want to follow our campaign, please do briefly take the survey that you'll receive after the panel is over, and you can stay in touch with us as we launch this Nourish Rhode Island campaign. And I want to thank all of these experts who have helped us bring this together, and particularly our legislative sponsors who are taking the bold move of putting public health first and the health and well-being of Rhode Islanders first. Thank you so much.
Thank you, Dr. Nunn. Thank you all for joining us. Be sure to stick around for the next panel. We'll take a 5-minute break, and then we'll be back.
Thanks, everyone, for attending the first panel. My name is Catherine Flynn. I'm the Executive Director of the University of Rhode Island Business Engagement Center. University of Rhode Island, as well as the Harrington School at University of Rhode Island, are pleased to be sponsors of this program. I am going to take 2 minutes of this 5-minute break to show you a fantastic video of URI's agronomy farm.
The agronomy agronomy farm is on the URI campus. URI was founded as a college of agriculture. The agricultural experiment station actually predates the university itself by 4 years, and we've always had farms on campus.
We're here at the University of Rhode Island's Gardner Crops Research Center, which is informally known as the Agronomy Farm. And it's where we conduct research on vegetable crops, for instance, grain crops. And it's also a great teaching resource for the University of Rhode Island. So we hold labs here and classes. So it gives students hands-on experience. You know, I just love to grow plants, I love to grow food, and I just really enjoy imparting some of my knowledge to them and seeing them grow and develop through our Sustainable Agriculture and Food Systems program.
I work with students in 2 different ways. So I have my classes where we're working in a large group, but then I also use a lot of student labor in my projects. So I have a lot of students who work for me, and we're working much more one-on-one, and we really get to know each other. A lot of the students I've had over the years are now the farmers that I work with.
My name is Farid Geshem. I'm originally from Iran, and I'm working on saffron here and also on vegetables. This year is the 4th year that we work on saffron, and every year we had the acceptable or good yield, and even more than twice as Iran. In Rhode Island, all the farms are so small, and saffron is a best option because farmers no need to have the machines, and it's great for this area, I think.
So here at the agronomy farm, of course, I'm always harvesting food from my plots. And so our food is donated to a variety of organizations and groups. So some of it goes to the Rhode Island Community Food Bank. Some of it goes to the Johnny Cake and Food Pantry, for instance, in Wakefield. Also our own graduate village, because we do have food insecurity issues here on campus. And so, of course, it's the University of Rhode Island, and we want to take care of our own.
I hope you all found that educational. We have many farms at University of Rhode Island, and that's just one of them. I also would like to take a moment to thank the Harrington School of Communications and Media, who is one of the other sponsors of this program. And here's a quick video about the Harrington School.
At URI's Harrington School of Communication and Media, every day is an exploration.
With global learning opportunities
and high-profile internships,
Harrington prepares us to be critical media consumers
and creative media producers
in the rapidly changing 21st century marketplace.
In strategic communications.
In multimedia journalism.
In sports media.
In writing and rhetoric.
In information analytics.
In digital media, film, and TV.
Our tight-knit learning community is tailored to build a solid foundation
for powerful creative communication
and a lifetime of achievement and opportunity.
Wherever our passions lead. Discovery, opportunity, impact.
The Harrington School of Communication and Media at the University of Rhode Island.
Visit today.
Welcome back, everyone. We hope you enjoyed the first panel. I now want to take a moment to thank everyone on the first panel and to introduce our second panel, which we'll be right back with.
Welcome back, everybody. Thanks for sticking around for the second portion of today's event. My name is CJ Oberthauser. I'm the Director of Training and Placemaking at Grow Smart, Rhode Island. And a lot of what we do centers around advocating for a variety of equitable transportation options. And of course, good transportation options necessarily are ones that connect people to what they need, food access being near or probably at the top of that list. So we are delighted to have assembled a great team today of thinkers and speakers to discuss the very important intersection of transportation and food access. And here's a little about that team. John Flaherty, my colleague, is the Deputy Director of Grow Smart Rhode Island, where his policy work is focused mostly on transportation, economic development, and community revitalization. Scott Avedizian became CEO of the Rhode Island Public Transit Authority in June of 2018 after serving as mayor of the city of Warwick for 18 years. Worth noting also that under Scott's leadership, RIPTA has not cut any service during the ongoing pandemic. And finally, Norbert Mundorf is a professor at the University of Rhode Island, where he has taught since 1987. With his background in communication, he is involved in various interdisciplinary research, teaching, and outreach initiatives to promote sustainable transportation, resilience, and health. My colleague, John Flaherty, is moderating this panel, so I'll hand it over to John and let him take it from here.
Thank you, CJ. And it's really an honor for me to moderate this important conversation with Scott Avedizian and Professor Mundorf, and with all of you who are tuned in today. And there are a lot of you out there that are doing innovative work to address the problem that so many of Rhode Islanders experience, which is the lack of reasonable access to healthy food. I also want to thank the University of Rhode Island for this partnership, as well as the Rhode Island Public Health Institute. I work at Grow Smart Rhode Island, which is our state's smart growth advocacy organization. We are a 22-year-old nonprofit that works in partnership with many others to strengthen and grow Rhode Island's economy in a sustainable and equitable way. Our unique specialty, I think, is working with community stakeholders to integrate the policies, tools, and best practices around land use, neighborhood revitalization, transportation, housing, and natural resource conservation. The work that we do in these areas really reflects our commitment to the 3 E's of economy, environment, and equity. So right now, more than 1 in 10 Rhode Island households are considered food insecure. And as we've heard from the previous panel, Rhode Island continues to rate among the highest in New England for food insecurity. Making matters worse, national estimates predict a nearly 30% increase in children who are food insecure due to COVID-19. So what do we aim to accomplish today together? 4 things, really. 1 is to establish a fact-based shared understanding of the food access problem in Rhode Island. 2 is to consider what measures are working here and elsewhere. 3 is to learn more about how improved urban mobility can reduce the food desert effect here in Rhode Island. And then finally, to identify what more can be done to make healthy food more accessible to more Rhode Islanders. To do that, first we're going to hear from Professor Mundorf about highlights of research findings that he's done documenting trends and the extent of the problem, as well as some innovative approaches, both here in Rhode Island and elsewhere, to meet this challenge. And then we're going to talk with Scott Avedizian of RIPTA about how food access fits into RIPTA's route and service planning. It's important to know, and I'm sure that we'll hear from Scott about this, but RIPTA recently completed a very ambitious and bold master plan for the future of transit in Rhode Island to really improve how people can get around the state, which has many benefits, but including better access to healthy foods. And finally, several of you on this webinar are already playing lead roles in meeting the challenge of food insecurity. Among you are academics, lawmakers, innovative nonprofits, philanthropies, food dealers, direct service providers, and many, many more. So we want to hear from you during the comment and question period as well. Our hope is that this conversation will spark some additional partnerships in creative problem solving. And to that end, we're going to be putting a series of links. We already have a series of links to resources, articles, reports, and tools on a webpage that you can find very easily. It's GrowSmart's webpage. It's growsmartri.org. And I'll repeat that again as we get a little bit closer. So first off, we're going to hear from Professor Mundorf. Professor.
Hello. Well, my area is communication, so you probably wonder what's the connection there, but I have been involved in promoting various dimensions of sustainability. And today I will access three related issues. First of all, improving food access across demographics and ethnic groups, which is the key topic today. Secondly, related to that, promoting healthy and active lifestyles. And thirdly, realizing social and health benefits of sustainable transportation. There's a complex relationship between food, transportation, health, and sustainability. One key idea that I would like to get across here is that changing from a sedentary to an active lifestyle can reduce multiple risks. It may promote healthy eating and address other risk factors. In addition, this change can benefit social and environmental sustainability. Let me first talk a little bit about food and health. There's an obvious connection. This summit is devoted to healthy eating and drinking, and we are all aware of the need for healthy food. But habits, culture, economics, and the food industry are often encourage unhealthy options. We have a prevalence of food deserts and food swamps, especially in low-income neighborhoods. Food desert, as you know, refers to the limited availability of healthy food, and food swamp is the abundance of cheap and unhealthy food. Typically, both of those coincide, so we have an abundance of unhealthy and a shortage of affordable, healthy food. So there are a few factors that promote healthy drinking. First of all, a change in culture. For instance, a plant-based diet is gaining popularity. Home cooking has become a standard during COVID. So there's a change there. In the education sector, Rhode Island has a successful farm-to-school program. In the media, many of us have seen Food Inc. and Cowspiracy, which makes us think twice about our next hamburger. And then, of course, also there are structural changes, like new organizations and expanded delivery options. In our own work, we are focused on communication and behavior change. Next, I will talk about transportation and food. There's obviously a vital connection. Local food distribution is a critical link. If you compare the middle-class pattern and the low-income neighborhood pattern, you'll see that typically, we have a high level of food security. You drive to the local grocery store with plenty of healthy and unhealthy food. There are alternatives, food delivery, curbside pickup, etc. Businesses such as HelloFresh, Amazon, Peapod. But these are often expensive and availability is limited. Now, by contrast, in the low-income neighborhoods, we typically find a high level of food insecurity, especially among children, as we have heard, and it's unfortunately increasing. Often there's no supermarkets nearby. Fast food outlets and convenience stores sell food that is high in fat and sugar. Families often lack reliable transportation, and delivery services are inexpensive or unavailable. Next, I will talk about options for addressing food insecurity in this context. I will not talk about government and social programs. That would take us too far. So first of all, access. Okay, so improving access for low-income communities. Corner stores are pivotal for that because you have many of those in the neighborhoods. And for instance, there's a program called DC Healthy Corners Program, which delivers healthy produce to to 67 corner stores in Washington, D.C., and similar programs exist elsewhere. There are also community initiatives, churches, food banks, nonprofits, etc. And more recently, there's even food delivery to homes or neighborhoods. Farm Fresh Rhode Island is an example here. And then, of course, there is improved travel to the grocery stores. And Scott will tell us more about what RIPTA is doing in this respect. The other way to improve access is through promoting local food. So Farm Fresh Rhode Island and others have set out to improve access to local and regional produce. Farmers markets increasingly take SNAP benefits, so that's progress there. There's also CSAs, Community Supported Agriculture. And of course, another option is to grow your own foods. Community gardens, your own balcony, which is limited, of course. And slowly in the suburbs, the idea of lawns into gardens is coming on, but very slowly. There's also organizations that finance local food venues. For instance, in Pennsylvania, we have the Fresh Food Financing Institute. Locally, there's the Raleigh-Shirodi Fresh Food Strategy from 2017, which specifically includes the goal to decrease transportation barriers to food access. And then next, I'd like to talk a little bit about transportation and health. So there's multiple risks involved in the sedentary lifestyle, which is prevalent. And then in Rhode Island and elsewhere, sustainable transportation options are important, especially since most of us, about 80%, use a single occupancy vehicle, automobile transportation. So what are sustainable alternatives? Carpooling is the primary mode in Rhode Island, actually. It's feasible for suburban and rural areas with limited transit. Western and southern Rhode Island have few alternatives. URI students also use carpooling a lot. Now, transit is more available in urban areas, and we will learn more about it in a bit. Cost is generally low compared to purchasing a vehicle. Tickets are often subsidized, not enough. There's actually moderate health benefit from transit, which many people don't know about. Research has shown that transit users walk an average of 90 minutes a day versus 6 minutes for automobile commuters. But finally, walking and biking is, of course, the most helpful alternative. Biking is limited as a transportation mode in the US. It's quite common in Europe and probably in Asia as well. Here it's mainly recreational. Walking is a little more common. About 3% of Rhode Island commuters actually walk to work or school. The key factors for walking and biking are safety, attractive walking and biking environment, and of course there's a vulnerability. The health benefits are well known: obesity, cardiovascular disease prevention, etc. And of course, environmentally, we're looking at virtually zero emissions for walking and biking. Of course, it also doesn't create traffic or parking problems as much. And finally, there's the complete streets approach, which is trying to incorporate all transportation modes, not just automobiles, and in urban design. And but there are challenges resulting from culture, habits, and social status. We have seen an increased availability of bike paths and bike lanes in Rhode Island through the Bike Master Plan. There's also a design focused on walkability, etc. To wrap up, the key question for us is to come back to the beginning. Can we combine sustainable transportation and food to promote health and quality of life? And finally, how can we use sustainable transportation to reduce food insecurity? Thank you.
Thank you, Professor Mundorf. So one of the things we want to do with this session today is really to have a conversation. We're not doing any heavy PowerPoint presentations, but this is a great opportunity to bring in Scott Avedisian. to share his thoughts about the role that RIPTA plays in helping to close the gap of access to healthy food. So, Scott, welcome.
Thanks, John, and thank you to Professor Mundorf as well for his comments. I also just wanted to say that the first session was incredibly interesting, and I wanted to thank Senator Valerie Lawson and State Representative Jean-Philippe Barros for their comments. They have been great partners with RIPTA, and appreciate all of their efforts. So, as CJ said at the very beginning of the session, RIPTA has not curtailed service during the pandemic, and that was important for a couple of things. A couple of reasons. One, access to frontline workers getting to their jobs was very important to us, and very important that the government that we continue to move, even though we're only at half capacity, that we continue to move people during all of this turbulent time. So 245 fixed route buses, about 125 paratransit vans, all continuing to operate at a reduced capacity. But even prior to the pandemic, we saw that there were places where we could do a more intense partnership with people looking to get to places where they could get food. So working with Meg Grady and Meals on Wheels, we were able to identify all the routes that you could take to get to any one of their city cafes where someone can go and actually get a meal. The outreach to senior centers to get people there for lunch and for dinners had already been going on, and then the pandemic hit. And then we had to try to figure out how we would still operate and be able to provide service, necessary service, in an even more difficult period of time. So we have 64 routes. Every single route except for the 24 Express, which goes from Kennedy Plaza to Fall River and on to Newport. 63 of our 64 routes have a supermarket somewhere along that route. And that was not always by design, but by past practice here, that we would make sure that we at least had a loop so that people could get to a place where they would be able to get food. Of course, during the pandemic, with reduced capacity, it has solved another one of the problems in that there's a usual limit to the number of bags and things that you can bring on the bus with a decreased capacity for people. Drivers have been letting people get on at supermarkets with more bags than they normally would. Also during the pandemic, we realized that capacity in a paratransit van was limited to only 4 people, as it still is, which gave us an opportunity to really deploy that service in different ways. So not only were we able to bring people to a city cafe that might still be open, that's run by Meals on Wheels, but we were also able to add meals into the paratransit vans when they were out doing their normal run in a neighborhood. So we have been able to bring meals to homebound seniors while a driver is out in the city of Pawtucket doing their regular routes, which has been really, really very positive for all of us to be able to see the thousands of meals that have been delivered. In addition, there was also a company that had shut down their operations and had everyone working from home, but they didn't want to leave the workers in the commissary without anything, without a job and without a salary. So they decided to donate their meals to the Office of Healthy Aging, and we were able to partner in order to have paratransit drivers, along with their regular routes, add in a stop to drop off boxes of meals that people could pick up. So that was the Gloucester Senior Center, the Burrville Recreation Center, Knights of Columbus Hall in Central Falls, the Pawtucket Senior Center, and again, thousands of meals that were able to be transported to places where then people could go get them. And then on top of that, our commuter resources team in a non-revenue vehicle delivered care packages to family service recipients to make sure that they were also helping in getting the word out to people and getting help out to people throughout this pandemic. So we have learned that between our fixed route, our flex service and our paratransit service, the number of people who are dependent on getting somewhere during the pandemic, whether it be to work, whether it be to the doctor's office, whether it be to any kind of a medical clinic, we're still moving about half the people we normally do. So we can see basically the drop-off has been in the fact that we are not transporting as many high school and college and university students to class, but virtually most of our ridership beyond them has remained intact. One of the interesting things that what we saw prior to the pandemic was the large increase in the large uptick in ridership on the downtown transit connector. And we have seen, once some of the restrictions were eased during the pandemic, those are the routes that are having the highest rebound and people coming back to the DTC routes quicker than any other routes in our system. But again, all of our routes have a supermarket on them, except for the 24 express service to Fall River and Newport. And I will tell you that we tried to figure out a way that we could entice people to take RIPTA to farmers markets, and we have not been successful in doing that yet, but we will certainly try again when the farmers market season begins again. With that, John, I'll turn it back to you.
Terrific. Thank you. Thank you, Scott. So as we said, we're going to have a very free-flowing conversation. I invite those of you in the audience to post questions, but I'm going to dig right in and say, just starting off with the transit aspect of this, since you just went, Scott. I think that a lot of transit advocates believe that RIPTA does an admirable job of deploying its very limited resources to provide access and mobility to people. And yet, I think we all recognize that those resources have been constrained, and certainly with COVID, it's been further constrained because of the gas tax revenues and so forth. I know that RIPTA was helped out considerably through acts of Congress, as were transit agencies across the country. And so I guess the question is, on a going forward basis and looking at some of the elements, I mean, one of the things we know, this is pre-pandemic, a person who's taking transit is oftentimes going to take significantly longer to get where you're going than if you're taking a car. And that's a function of how many buses are deployed, the frequency of the service, the span of hours, and so on and so forth. As you look to the implementation of the Transit Master Plan, can you speak to some of the priorities that you think are going to make the most difference for people in terms of being able to get access to healthy food without it having to take, twice as long or longer in order to get their groceries and have their frozen foods thawing out and so forth?
Sure. So, John, as you know, our two most populous routes are the R line and the downtown transit connector. So as part of our plan, we would like to create more R line service. What we found, especially during the pandemic, was, and with decreased capacity on a 40-foot bus, we would put paratransit vans behind a 40-foot bus when available, so that we could get overflow. But the fact that so many people use the R line and so many people are using the DTC with 5-minute frequency, the whole issue of going out to, obviously Fall River was a win for us because of the numbers of people that were moving. Quonset is a win because of the fact that we're bringing people to work and they weren't able to get to that location before. So there are wins like that, but really it all comes down to frequency, and more R-line service will get people to the doctor's office, to the supermarket, to the any other store that they need to go to quicker, more efficiently, and more effectively. And that's really where one of our focus points really needs to be, increasing the frequency and reducing the headways.
Terrific. Going back to Professor Mundorf, I'm really glad that you focused on some of the related health benefits of more active transportation, be that transit, because all transit riders are pedestrians, bicyclists, and so forth. Given that there's no silver bullet for tackling this challenge, what do you see from your research and things that have happened elsewhere? What do you see as some of the most promising opportunities for Rhode Island to make gains in bringing about some more rapid changes that will improve people's accessibility and also just overall public health?
Well, I mean, we've heard from Scott that RIPTA is doing a lot, and there's a lot of improvement in terms of that. And also, I didn't get into it too much, but I mean, there has been progress in terms of bike lanes, bike paths, and even walkability. So pedestrian safety is a big factor. Much more so than pedestrians are much more vulnerable than auto commuters. And so, but I think that probably in the future, I mean, we have one thing that didn't talk much about is intermodal or multimodal transportation. So combining modes of transportation. And I think that's an important trend. If you think about, everybody now most people have a smartphone, so it's easier to figure out when your next bus gets there, and where the bus is right now, and all those kind of things. And because that's a big frustration about taking the bus, is that you don't know if it's late or if you missed it and things like that. So I think having the access to the technology is a big improvement, and that can help that can make taking the bus more popular. Also, I think one trend that's changing is, I think, for young people are less into cars than they used to be. I mean, they still are, but I mean, I think that it's because of social media and things like that. I think a lot of the social interaction, it goes through that venue, and so I'm also hopeful that teenagers, etc., or young people will start to rely more on bikes, walking, in combination with transit, in the backdrop of social media and media technology.
Sure.
Right.
So, John, one of the other things that's important is, as the professor just said, about people with smartphones. The other thing I need to talk about is the fact that RIPTA has fully changed our fare product, and we now have we're using wave technology. So one of the things that bothered me most when I first got here to RIPTA, someone would call and say, I lost my bus pass. And we had no way of proving that they actually had a bus pass. It wasn't registered anywhere. There was no account for them. There was no way to prove that their bus pass, that there was actually a bus pass that they had purchased. So now with the wave technology, that bus pass can be put and secured in the cloud. So if you lose your bus pass tomorrow, we can go in and we can see exactly how much you had on that bus pass, and we can return that, which is so important for people who are having difficulty making the monthly payment for the bus pass to begin with, to make sure that that's protected. But then if you want to take that a little bit further, the first of the month you only have $20. So you can't afford the full monthly pass. So you put 20 on, you would buy a $20 bus pass. When that would run out, you'd buy another one. Well, under this new fare technology, as you add money to where the full monthly pass would have been, you run the rest of the month for free. So that's really a fairness and equity issue that we think that we are helping get people to a point where even if you can't afford the higher fare product at the beginning of the month, you're not penalized as you make your way through the month, as long as you get there.
That's a great point. I'm so glad you brought that up. And it raised a question in my mind about how many people riders have access to smartphones. And do you? I think you said you have some data to indicate that that number, that percentage is pretty significant.
It is. The last time that we surveyed, we had over 80%.
That's terrific.
Pretty high. And the thing that's really important, and I know it sounds kind of policy wonkish to focus on it, but for the first time, we actually can guarantee that you're not going to lose your benefit if you lose your card. And it's so important to be able, heartbreaking for people to call and say, I don't know what I did with my bus pass. I just bought it, and we could never prove that they actually had one. So from a whole bunch of perspectives, this is a really important change for RIPTA. Also, during a pandemic, you don't really want the interaction between someone paying for their fare. The Turnpike and Bridge Authority is doing a pilot program right now on cashless system. We're looking to go to being a cashless system here as well. And so there's a lot of reasons why this is a good initiative and a good advancement for not only the authority, but also for all of our riders as well.
That's great. I mean, that I've been a big proponent of public transportation. I'm a daily rider myself when we're not in a pandemic and when I'm not working from home. And I think that there is significant opportunity for Rhode Island when you consider the fact that in our state, it's almost 80% of our state's population, which is a pretty big number, lives within a 10-minute walk of a transit stop.
Right.
And few other states could claim that. So we've got the benefit of already having this density in a transit network that reaches across the whole state. We still have few people on a percentage basis that use it. And I think part of that is a function of what we talked about before. It's about frequency, it's about span of hours, It's about getting where you're going in a reasonable amount of time, because people will always make the rational choice. So my question is, given where we are, given the anticipated multi-trillion-dollar infrastructure climate initiative that we're expecting from Congress, and now that we've got this recently completed and very well publicly vetted transit master plan, what are your hopes? What are your expectations in terms of our ability to accelerate the implementation of that, which is in many ways, it's about putting more service on the street. It's not as much about building new infrastructure. So can you speak to that?
Right, John, as I said before, it's all about frequency. If it's convenient and efficient, people will take it. So we've been, in the last couple of years, working on pilot programs that would really be able to be an indicator as to what the uptick could be. So we have service that's starting in Central Falls, where we will be geofencing the entire city of Central Falls so that any resident of Central Falls that gets on a bus in Central Falls can ride for free. And that's an FTA demonstration project that has great support from former Mayor James Diosa and current Mayor Maria Rivera. And that's an opportunity to be able to go out and show people that there's huge ridership opportunities that we can connect into the new Pawtucket Central Falls train station and bus hub. And those are the types of things that we can show people. That's why our line service extension into Central Falls would be important. And that's why it would be effective. And that's why high frequency numbers are important. And the Transit Master Plan lays out all of those regional hubs and the connectivity between all of them to show people that there's a logical way that you can take public transit from point A to point B on a regular basis.
Well, I can quickly interject. Also, there's actually some research that shows that people underestimate the time that it takes to drive somewhere versus alternative means of transportation. So people tend to always think that the car is the most efficient way of getting around, and so obviously it helps the mobile service you have, etc. And of course also the more connectivity to other modes. And I was still thinking multimodal transportation is the way to go. So I think a lot of it is changing the culture, and that's difficult, because we don't. Probably, if you were in New York or somewhere, public transit is kind of natural, but here in Rhode Island and places like this, it's less common for most people to think about transit or bikes or whatever as a legitimate means of transportation.
Great point. So, Professor Mundorf, some of the research that you've been involved with or have followed calls attention to community gardening. providing affordable, local, and healthy way to obtain local food. What further action do you think is needed to accelerate that? I know we have examples throughout the state where that's been working well. So what are some of the things that can be done, do you think, to amplify that message and to spark additional innovation as it relates to community gardening?
Again, I think it also has a lot to do with the culture and the attitude. So probably starting with the children. Sounds like a cliche, but I think if you get to more maybe elementary schools, and I think they already do it, but I mean, if you get kids in elementary school to start, learning about gardening and things like that, it becomes more natural to them. And then once they go up, I mean, that's a long process, obviously. But of course, also, the general population. And I think during COVID, growing your own has become more popular, but not as rapidly as we would wish. But I think that if we change the culture, we can make a good headway in that area. And of course, we also need more land available, and a lot of and availability of farmable land is limited here, unless you start digging up the lawns, and we're not there yet.
Yeah, terrific. I know that we know from hearing from the previous panel, there was discussion about food on the move having some success, and in response to the pandemic, last June, a rule changed in which SNAP can now be used for buying food online. I don't know if Professor Norbert Mundorf, if you've seen any evidence to indicate that that those policies are having impact.
I haven't seen any data, but I would think, the easier you make it's just like with the paying for the bus. The easier you make the payments, and of course also if you integrate these benefits, that's a way to promote usage. So I can just generally comment on that. However, we were asked to mention that we're taking questions from the audience now. We have a couple of questions that we can start with. So if you have any questions in the audience, please let us know.
Great idea. So why don't we start with there's two of them, and this is from Mary Alice Smith, asking about why moving the transit center from Kennedy Plaza in downtown Providence. The current location is convenient to the train station, the Providence Place Mall, and the State House. The signage is terrific because the bus stops carry info about when the next bus is coming. I know that you get a lot of real-time information technology at work to do that. This has been, and I'll just start. This has been a topic of controversy, and I don't know that it's resolved yet. A lot of advocates have concerns about it, and it is a DOT project. I guess I'll just ask Scott if you have any comment on that.
Sure. Obviously, our goal is to make sure that the end product is better for all of our riders, and whether it be a multi-hub, and we're trying to still address which routes will go where. But a multi-hub can work if we have the right technology, if we have the right real-time signage, if we have the turning radiuses that all work, and that's what we've been working on for the last year or so.
Okay. And then I'm going to move to this next question from Irene, and she says, talking about multimodal transportation, two of RIPTA's lines, the 62 and 66, are currently not lined up with the MBTA commuter rail, and she wants to know if there's plans to improve coordination across state lines.
So a couple of really good points here. One, up until a few years ago, we could not operate service outside the state of Rhode Island. That was a rather archaic system. So basically, if you noticed, all of our Newport service went through Bristol because we had to stay within the state. So we were able to finally get some changes to allow us to be able to better serve communities and adjacent Massachusetts and Connecticut communities. Yes, we want to line up the 66 and the 62 to better coordinate with MBTA, but that's part of a whole more intensive regional rail system that's been going on and trying to get more service, more train service and more frequent train service and at different hours. So it's part of a much larger conversation about trying to get more infrastructure to have more trains that would allow us to then move our buses around those trains. But it also, those changes allowed us to do the service to Fall River and to Newport, which has been well received by the riding public. And planning and Greg and I will be going down to Westerly later this week to try to figure out some seasonal work that might be able to be done to alleviate some of the congestion that goes on with the out-of-state cars that go into Westerly every summer to go to the beach. And so having that change in the state law gives us an ability to go do some other things that we were never able to do before. And as you probably have heard, we've been working on a potential summer seasonal transit program on Block Island. And because of the new enthusiasm on the DTC, people are seeing that there is a reason why we should be having discussions with local communities as well.
Speaking of that, with your transit master plan now completed, and as you begin to do implementation, can you speak to what municipalities or other community organizations, like some of the health equity zones, what they can do to better partner with RIPTA? I'm thinking about, for example, some of the challenges of accessing supermarkets. Oftentimes they have to go in to a plaza of some type, and accessibility issues or concerns. Does RIPTA have a seat at the table when some of these development projects are underway? Can you speak to that?
I would tell you it differs project by project. We don't have a right of way to go anywhere we want. So if a business owner or an owner of a strip mall or a shopping plaza decides that they don't want us there, we have no right to bring people to that location. We have to petition them to allow us access to their property. So it's a constant battle. And we have some property owners who don't want us to be there. We have others that would really like us to be there, but we can't access the location based on a turning radius, or there is one building in particular that we get requests for all the time, but there's no way for us to actually get into the actual location with a bus. So we try to be on the ground floor on new development so that we can have a discussion about what circulation could look like inside on the interior of a proposal that's up for development or up for approval before a planning board or a zoning board. But it is pretty much hit or miss. Some communities very willing to branch out and have a discussion with us, and others that were not consulted until after something's already been approved.
Got it. I don't know about you, but all eyes seem to be focused on Washington, D.C. right now, because as we think about the state of Rhode Island's economy and our budget, obviously we're very dependent upon what the federal government does. We have a new Secretary of Transportation in Pete Buttigieg, and I've been hearing a lot of very encouraging words from him about the focus of the U.S. DOT on a going forward basis. Have you had any contacts either with the U.S. DOT or with the Federal Transit Administration? Any insights into what we can expect that would better enable Rhode Island to accelerate the implementation of our plan?
Well, I think obviously the most important asset that we have is our congressional delegation and the ability of Senator Reid and Senator Whitehouse and Congressman Cicilline and Congressman Langevin to have the direct access to the Secretary So Governor Raimondo going off to be the Secretary of Commerce. The governor and Council President Sabina Matos, myself, Treasurer Magazina, Mayor Alorza, we're all Aspen Fellows at the Aspen Institute, Rodell Fellows at Aspen together with Secretary Buttigieg. So I think we have a number of Rhode Islanders who have an opportunity to reach out to him and explain how important the federal support of transit would be and federal support of transportation. And I think that the Transit Master Plan really gives us a blueprint to be able to say, this is, light rail from T.F. Green Airport to Central Falls, connecting all of the R lines that currently exist. That could be a game changer for most people trying to go to work in the morning. And that's maybe too visionary for many people, but it really is where we need to be looking. And if it's not that, then something else. Remember that the Downtown Transit Connector was supposed to be a streetcar proposal. And when that didn't work, RIPTA was called on to repurpose all that money and to make that, and to be able to go out and sell that proposal. That proposal has really allowed us to look at things in a different way. And when you have 5-minute frequency all the way from Rhode Island Hospital to the Amtrak station, that's a game changer for a lot of people.
I'm reminded that we're going to be wrapping up soon. I see the clock on the wall behind you. It's keeping me informed of where we are. So I think we have time for a couple of more questions. I see we have two in the chat, and the first one is from Nicole, who asks whether RIPTA has a seat at the table in the discussion about the Newport North End urban plan. I've been following that quite a bit myself. I know there's a lot of work that RIDOT will be doing to reconfigure the ramps and open up space for development. And some people have talked about the benefit of having some type of a facility at the end of the bridge in Newport when you get off, where you could use transit to get around and not have to clog up the streets in Newport. So can you speak to what involvement you all have had with the North End plan?
Sure, John, we haven't had any involvement directly with the North End plan, but let me tell you that Mayor Jean Marie Napolitano, in coming back into the mayor's seat in December, one of the first things that she did was release the RFP for changes to the Gateway Center because the parking garage needed some structural work that was impeding an ability to get people to go there to park there. So I think that the council in Newport, under her leadership, is really looking at what they can do to give us the best possible situation going on in Newport. So we've been working with Kate Cantwell in the health equity zone there on ways that we might be able to create different routes in Newport to serve people who aren't on a fixed route bus site. And that obviously during a pandemic with only 4 people on a paratransit van, it's hard to move people if you're not on fixed route. So we would be happy to go sit with the planning department in Newport and to have discussions about ways that RIPTA could do that. We also would love to be able to look at some point. The CCRI Newport campus is in the perfect location if we could create some kind of a mini hub there as well, to be able to better serve that neighborhood.
That's terrific. Well, with that, we do have a final question here, and that is, what role can residents and neighborhood associations play in increasing food access in their neighborhoods? And I think I'll turn to Professor Mundorf.
Well, I think they could play a big role. I mean, first of all, as I've been saying earlier, awareness is key, and so I think if we can create more awareness among the different population segments, that helps. And then also, I think I mean, you can talk to businesses. I mean, just heard from Scott that some businesses are more receptive than others to invite these innovations, and so I think that's another area, and so I think there's a lot of potential, and I think the more we have bottom-up momentum, the better the chances that we'll get change.
And to that point, I would encourage folks who are interested in these topics to become familiar, if you're not already, with Rhode Island's newly adopted transit master plan. You can look at the impact it would have in your own community or across the state. Also is the bike mobility plan, which goes hand in hand with transit. We have put some links to some of these resources on a special page that's Transportation and Food Access on GrowSmart's homepage. You can see that. It's growsmartri.org. And with that, I think I'm going to turn it over to CJ to wrap.
Thanks, John, and thanks so much to all three of you for that really engaging discussion. Sounds like there's a lot of work to be done, and luckily lots of action items to go along with that our viewers can take home with them. So I'll just hand it right over to Catherine to close this out for the day.
Thank you. Thank you, CJ, and thank you to all our panelists for the day. This has been a really great conversation, free-ranging from transportation to food access to food insecurity, and we really appreciate all the people that have participated in the day. Thank you also to Leah Cooper from the Harrington School of Communications for helping us with the technology for this event. And we hope that all of you will consider joining us for one of the Food Center's upcoming events. The next event will take place on Wednesday, March 10th. That will feature a discussion from the Center for Ecotechnology about how we can reduce, rescue, and recycle wasted food. So I think that will also be a very interesting conversation. Please visit our website again to sign up for that. And we look forward to seeing all of you again soon. Thank you on behalf of the Business Engagement Center at the University of Rhode Island, and enjoy the rest of your day.